I'm here with Dr. Debra Mays from Cincinnati Children's Hospital. Dr. Mays, so much of the community does not have a PhD or MD at the end of their name, and I think we find it a bit difficult to understand the connection between, a fruit fly and a human being. Could you kind of fill in some gaps as to how things go from the bench or the research labs to the bedside?
Okay, it's a complicated issue, but effectively, I'm working with basic science. So really we're trying to figure out the mechanism of exactly how the molecules are affecting the various cells that we're interested in. And if we can figure out not only the pathway, but how those work together, which is much easier to do in cell culture and an animal model. And usually we start with cell culture because it's cost effective, we can get some of the drugs through, we can see whether or not there's efficacy, which means that, is it working, right? But then we can move it into an animal model. So if we have these animal models that show a phenotype is just something wrong with the animal. So the cells aren't doing what they're supposed to be doing. And are those cells not doing what they're supposed to be doing the same way that it happens in the human disease? And if that's our model, and if the same thing happens in the animal that happens in the human, we can then take some of these drugs and some of the molecules that we're really interested in because they're acting like they're not supposed to, and move that into animals. And then if that works and we can actually get those animals to feel better and move the molecules in the direction that we want to, so manipulate them in the right way, then it makes sense to move it into a human. And we can test in these animal models and the cell culture whether it's safe. You don't want to give these drugs to patients if they're not safe. You want it to be relevant to the disease, and you want to know what kind of symptoms they're going to have, which is vitally important. So even if something worked really well, you could get rid of the tumors, or you could change the learning memory problems, or affect the bones. Is it going to affect their liver? Is it going to affect brain growth? How's that going to affect them for the rest of their life? And sometimes it's worth it. If the symptoms are severe enough, well, maybe you would want your child to have, that drug. But the more basic science we do, the less symptoms you could have, and more specific we can make it for the little problem that they have here, and literally focus on that one problem. So that's what we're really trying to do.
Excellent. Thank you very much.